Hello everyone. So today I'll be talking about non-invasive laboratory and instrumental investigations. I'll be mainly focusing on blood tests, urine analysis, and X-rays. So starting off with blood tests, these are the most common types of blood tests, and I'll go over each one of them in the next few slides. So starting off with CBC, it's also called the FBC, a full blood count. Uh, in my previous video, I explained all the components of a CBC in detail. So today I'll only be focusing on the main components of a CBC. So a reduction in RBC would indicate anemia, and also nutritional deficiencies like B6, B12, and iron deficiency would manifest as anemia as well. A large increase in WBC would indicate leukemia, and a slight increase would usually indicate inflammation or infection. A decrease in platelet count would cause bleeding and clotting issues, and reduction of all three types of cells, red blood cells, white blood cells, and platelets, is known as pancytopenia, and this is caused due to a disease in the bone marrow. The metabolic panel checks for levels of certain compounds in blood, and we can assess the functioning of the kidney and the liver using these levels. So kidney function can be assessed by the blood urea nitrogen and the creatinine levels. Increase in these levels would indicate a dysfunction of the kidney. An increase in alkaline phosphatase, ALP, alkaline aminotransferase, and aspartate aminotransferase, and bilirubin would indicate liver dysfunction. And also, alkaline phosphatase is a marker of cholestatic disease. Increase of glucose and HbA1c indicates diabetes, and also changes in the electrolytes would indicate an electrolyte disturbance or an acid base disturbance or a kidney dysfunction. The lipid panel, there are four main values that can be obtained from lipid panel: the HDL, LDL, triglyceride, and total cholesterol. HDL is also known as the good cholesterol because it removes the harmful deposits which are found in the arteries, and transports them back to the liver. And the LDL is what gets deposited in the arteries and form plaques, causing atherosclerosis. And this is how you calculate the LDL and the VLDL levels. And ideally a patient should have an increased HDL and a decreased LDL level. So enzyme markers. So enzymes are usually found specifically inside the organ, and some enzymes are specific to each organ. So, for example, troponin and CKMB are found exclusively in the heart. So, a damage to the heart would increase the level of CKMB and troponin in blood, indicating a heart attack. And also, creatinine phosphokinase (CPK1) is found in lungs and brain, and high level of CPK1 in blood would indicate a brain injury, stroke, bleeding, or cancer. The coagulation panel, so it usually measures the PT, PTT, platelet, fibrinogen, and D dimer. And in hemophilia, the patient's blood won't clot properly. So because of that, there'll be an increased PT and PTT levels. And this occurs because the coagulation proteins are not working properly. And if the patient's liver is not functioning properly due to hepatitis or cirrhosis, the coagulation factors will not be formed. So because of that, the PT and the PTT levels will increase, and the patient will be susceptible for bleeding. An increased D dimer would indicate DIC. So moving on to urine analysis. So these are the most common pathologies seen, which can be diagnosed from urine analysis. So starting off with UTI, of course, we have to pair it up with a microscopic test as well to diagnose the pathogen. And the urine appears to be cloudy and turbid, and also an increased levels of nitrites and leukocyte esterase is seen in a UTI. And if the patient is dehydrated, the gravity is high, and also since the water content is low, the urine appears to be dark yellow in color, and also hyaline casts will be seen. In acute tubular necrosis, there'll be muddy brown casts, and also the urine would appear dark yellow and amber. In nephrotic syndrome is characterized by severe elevation of proteins, and also there'll be fatty casts, and due to the increased amount of protein, the urine will be foamy. And in nephrotic syndrome, there will be RBC casts. So because of that, the urine would appear to be red or brown, and there will be a mild or moderate increase in RBC. These are the crystals found in urine. Usually crystals are found in nephrolithiasis. So there will be uric acid crystals, calcium phosphate crystals, and calcium oxalate crystals. These are the most common crystals that can be found. Casts, we talked about casts before, and there are two types of casts: cellular and acellular. Cellular casts, RBC casts or WBC casts. RBC casts are seen in glomerulonephritis or nephrotic syndrome, and WBC casts are seen in interstitial inflammation or an infection. Hyaline casts, as we mentioned before, are seen in dehydration, and muddy brown casts seen in acute tibial necrosis, and fatty casts are seen in patients with nephrotic syndrome. Finally, moving on to X-rays. So these are the types. These are the main types of X-rays: the plain X-ray, which is a 2D image, and a special type of X-ray is a CT. It is combined with the computer to get a 3D image, and fluoroscopy is a moving or real-time image. So as you can see here, we can see the patient swallowing water, and mammography is a X-ray of the breast, which can be used to diagnose breast cancer. And in our previous video, we went over the most common pathologies in each system. So today I'll be only focusing on pneumothorax and hemothorax, because we didn't talk about those in our previous video. So the symptoms of pneumothorax are dyspnea, tachycardia, hypotension, neck pain, distension, and pleuritic chest pain. So as you can see in the X-ray, we can see a white line, which is the visceral, the pleura, the lining of the visceral pleura, and we can see that this is completely dark in color, and all the air is accumulated here, and the patient might have subcutaneous emphysema, and also the lung may be collapsed. And peripheral to this line, we will not see any lung markings, because the lung has collapsed into this portion. Hemothorax is presence of blood in the pleural cavity, and you can see a whiteout of lungs, which means in here you can see the left lung has been completely completely covered with blood, so it's called a complete whiteout. And this is a partial whiteout because only part of the lung has been is covered by blood. And this is in X-ray, this is usually similar to a pleural effusion. So you can see blunting of the costophrenic angle. So the costophrenic angles are not seen here. You can see the costophrenic angle here, but you cannot see it here. And also the lung will appear like a meniscus, and if there's an accumulation of large amount of blood, the mediastinum will shift as well. And that's it about non-invasive techniques. Thank you.